We are back with yet another episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I am Jessila Mujib. In each episode of this talk show, we bring before you an expert doctor from Al Hilal Hospital to address your various health issues to guide you in your journey towards good health. Endometriosis is characterized by severe pelvic pain. But don't worry, we have with us Dr. Brahma Lakshmy from Al Hilal Hospital, Muharraq. She is a specialist in obstetrics and gynecology, and she is also a laparoscopic surgeon. So, let's discuss the topic in detail with the doctor. So, doctor, thank you for being with us today and welcome to the show.
Hello, Yasila.
Yeah. So, doctor, what is this endometriosis? Can you explain in detail and how common is it these days?
Hello, everybody. Endometriosis is a disease which is the diagnosis of which is very delayed usually. Okay. So, endometriosis per se, when I tell you, it is every month what happens to our uterus, there is a lining inside the uterus which is called the endometrium, which sheds cyclically if you are not getting pregnant. So, that endometrial lining should be within the uterus. It is the innermost lining of the uterus. In endometriosis, this lining cells are seen outside the uterus, on the surface of the uterus, on the surface of ovaries, on the fallopian tube, on the peritoneum, the inside cavity of the abdomen, even in distant places sometimes. It is said to be seen in the pleura, in the lungs, in the lymph nodes, lots of other places as well. So, it is basically the endometrial tissue being seen outside the uterus. Anywhere outside the uterus, it is not normal. So, that is what endometriosis is. How common it is? Maybe because of advanced diagnostic techniques now, the advancement of laparoscopy, of course, it is diagnosed in about 10% of women, okay, 10% of women in the reproductive age group. It is said that about 180 million women all over the world are affected and diagnosed with endometriosis. So, it is seen quite common these days, and of course, like you said, the pain is what brings the patient to us. So, yes, endometriosis is basically the uterine lining being seen anywhere outside the uterine cavity.
So, you described about endometriosis. So, doctor, can you explain the symptoms for our viewers?
Yes, the most debilitating, most common symptom, like you said, is pain. Pain, initially it starts with pain during periods, we call it dysmenorrhea. But later on it is seen that even not during periods, even in between the cycles, patients complain of pain. It can be pain during periods, pain in between periods, pain while passing urine, pain while passing motion, backache, so all sorts of pains. That is something that is commonly seen, and patients come to us with either this kind of dysmenorrhea, pain during periods, or pain in between any time. Second thing is, these patients can have irregular heavy bleeding also. So, that is another symptom of endometriosis. Then a large group of patients come to us not with these symptoms, but they come to us, they have been trying to become pregnant for years together, maybe 2 years, 3 years, they are not conceiving. So, as a case of infertility, when we do the workup, we end up diagnosing them to have endometriosis. So, these are the various symptoms of the presenting complaints, you can say, the patient come with.
Now, you said that severe pelvic pain is the main symptom of endometriosis, yes. But severe pelvic pain may be the symptom of many other illnesses also.
Yes, that is why diagnosis of endometriosis gets late. It is said that diagnosis of endometriosis goes it can get delayed up to 8 to 10 years from the onset of symptoms. Like some adolescent girls who just attain menarche, the initial few years will be okay. After that, they start appreciating severe pain during periods, and it is usually neglected. They lose their school hours, sometimes they miss their work hours, but that is neglected, and later on in life, when they end up having got after marriage, when they come to us with infertility, that's when they're diagnosed with endometriosis, which would have been there all along. Also, there are patients who ignore not just this dysmenorrhea, the pain in between. Pelvic pain, when we talk to each other, women when they talk to each other, they think, okay, this can be normal, this can be urinary tract infections, or this can be any other diseases. And the problem with endometriosis is always an ultrasound is something that we regularly, routinely recommend to any patient who comes with any kind of pain in the abdomen. But ultrasound might not detect an endometriosis, because endometriosis per se, like I said, the endometrial lining is seen outside the uterus. If it is on the ovaries that the endometrial lining is, then the ovaries develop cysts, which are called chocolate cysts. They have blood within it, because the endometrial lining produces, it sheds every month, right? So when it sheds, it produces blood and the mucus which comes out. Each cycle, this blood gets accumulated and forms a cyst within the ovary, which is called endometriotic cyst or chocolate cyst. And that is 1/3 of the presentation of endometriosis, because endometrial deposits can be on the peritoneum, which will keep bleeding and causing inflammation, fibrosis, causing adhesions and all the pain, but it won't be detected in an ultrasound. Same thing with deep endometriosis. Endometriotic infiltrates can go deep into the bowel, into the bladder and other tissue within the abdomen, which will again cause inflammation, fibrosis, adhesions. Everything gets stuck to each other, which again causes severe pain. So those kind of endometriosis, or 2/3 of the endometriosis, is not detected by ultrasound, because of which we miss the diagnosis. So the gold standard of diagnosing endometriosis is by doing a laparoscopy. So when patients have severe pain and all these symptoms, it's basically from the history that we get the diagnosis. Severe dysmenorrhea, pelvic pain, pain which is progressively increasing with every cycle, they have more pain, and then the pain becomes every day. So that is something that is typically seen in endometriosis, which when they come to a doctor, when we end up doing a laparoscopy, the one good thing about laparoscopy is that you can diagnose the disease, at the same time treat the disease as well. So that is also there. So that is how they end up being diagnosed to have endometriosis. So ultrasound do detect a few of them who have these cysts within their abdomen, but otherwise they are diagnosed only by a laparoscopic procedure, when we actually go inside the abdomen and see what's happening inside.
So when you see the symptoms, you suggest a laparoscopy, is it?
No. See, any operative procedure should have an indication for why it is being done, yes. So when they come to us initially, of course, the initial ultrasound, we would give them the medical management. Pain during periods is something that can be treated with our regular analgesics. When they don't get relieved, that is when we end up doing a laparoscopy. So that would be the first diagnostic modality, of course. That is why there is always a delay also. Whenever it is an operative procedure, anybody would hesitate from doing an operative procedure for a diagnosis. So it gets delayed, the diagnosis per se gets delayed, but that is the only method by which we can actually see what's happening inside the tummy. And laparoscopy, diagnostic laparoscopy, is not a very complicated procedure. It's just that we have to undergo, be under anesthesia. The laparoscopic ports are hardly 1 centimeter, 0.5 centimeter. You might have 2 holes in your tummy, which is stitched up, it heals off very fast. So yeah, so laparoscopy is the gold standard for actually diagnosing endometriosis.
Okay. So doctor, another common query is what are the causes, any specific causes for endometriosis?
Yeah, unfortunately we don't have any idea about why endometriosis happens in anybody, but there are various theories which have come up over a period of time. As it is said that for some reason when we think also logically, for some reason the endometrial tissue is being dislodged from the endometrium and going to other places. That is why it is going and sitting there, growing, shedding, bleeding, and again it grows again. With every period it keeps happening. So when that happens, there should be a reason how it goes there. The one of the things that we say is uterus connected to the tubes, the fallopian tube, and the fallopian tube is open into the peritoneal cavity. So retrograde menstruation, as in menstruation happening, there is some amount of endometrial tissue that goes through the fallopian tube into the endometrial cavity, the abdominal cavity. So those small deposits can sit there and grow. Okay, so one of the commonest areas where we see endometriosis is the ovary, of course, ovary, fallopian tube. So it is the proximity near the uterus it is forming. So maybe endometrial tissue is being pushed out through the tube outside, causing these growths. Another theory is that even through blood or through the lymphatics, lymphatics are channels through which are sometimes when we have infection somewhere, the lymphatics bring up it into the lymph nodes and other places of the body. So that is another channel through which these endometrial tissue can go from one part of the body, that is the uterus, to the other parts of the body. There is another type of endometriosis where wherever there is a scar, like somebody has undergone a cesarean section. After that, on the scar we see nodules which grow, they have pain. Every time they have periods, it grows a little more. Like that, it keeps on growing. That's when we realize, okay, that is an endometriotic nodule, which is again this endometrial tissue being deposited there because it has come up through the incision, the scar that we made. People have endometriotic nodules at their umbilicus, which is again there is a connection between the cavity and the umbilicus. So again there are different methods by which it is said to reach other places. How it reaches the lungs, the pleura, again same thing, maybe through the blood or the lymphatics, it is reaching different parts of the body. So there are various theories, even genetics. It is said that endometriosis runs in families as well, so maybe there is genetic predisposition. So all those things are theories, though we don't know the exact reason why endometriosis happens.
Okay. So once we are diagnosed with endometriosis, what are the treatment options you go for?
Yes, like I said, pain is the predominant symptom in endometriosis. So the first modality of treatment would definitely be a painkiller. So there are safer painkillers. Then we might have to go higher up as well, but that needs to be given only during the periods. So because of which we do give them painkillers as the first modality of treatment, especially the non-steroidal anti-inflammatory agents. Lots of painkillers are available in the market which can ameliorate the pain when it's only during periods. When it becomes a constant pain, when it becomes pain every day, the next option that we have is using contraceptive pills. The contraceptive pills that we use for use regularly, the 21 days, 24 days, 28 days pills. So those pills, what they do is they decrease the blood flow, they thin out the endometrium. So just like the decreasing the blood flow within the uterus, coming out from the uterus, similarly all these endometriotic deposits that is happening everywhere, the bleeding becomes less, then the endometrial lining becomes thinner, because of which the pain is relieved. That is another medical option. The third one is using progesterones. Progesterone, again, our hormone which is produced after ovulation happens. Progesterone thins the endometrium. Estrogen thickens up the endometrium while progesterone thins down the endometrium. So we can give progesterones. Progesterones again thins down the endometrium, makes it bleed less, makes the inflammation less, because of which the pain and the severity of the endometriotic lesions becomes lesser. Then advanced things are using something called GnRH agonists and antagonists. These are injectables. They basically cause a artificial menopause or a temporary menopause. When you're given the injection, the ovulatory function goes down, because of which the estrogen and the progesterone hormone, estrogen basically is reduced, so the endometrium doesn't become thick. So wherever there is this endometrial deposit, it gets atrophied, and the patient also has symptoms like menopause, like because there won't be periods, the pain is relieved, all those. So it is a faster acting thing when compared to tablets. Of course, tablets will take some time for the endometrium to become thinner with tablets. So injectables. There is a newer medicine called DAGES. Again, same thing. It atrophies the endometrial lining, because of which the patient won't have periods, and the endometrial cells anywhere in the body undergoes atrophy. So basically all medical management aims at thinning down the endometrium or making it stop bleeding, because of which these treatment modalities can't be used in a patient who comes to us with infertility.
Okay.
Yes, they need ovulation, they need a baby. So the egg has to be formed. So anovulation or bringing them symptoms of menopause is not what is the treatment option. That is when surgical correction of endometriosis comes up. Also in patients who have large ovarian cysts, these endometriotic cysts can become really huge. 10 centimeter, 16 centimeter ovarian cysts we have seen. Some become so big that they rupture within the endometrial cavity. So endometriotic cysts, which are large, of course needs surgery. So surgical correction is required only in patients where all these medical management, if they are not planning to conceive, all the medical management still fails and the patient has severe pain, then we might do a surgical correction. When there is a large ovarian cyst, we do. Otherwise in patients who have infertility. So here what we do is, if there are ovarian cysts, of course we remove the cyst, causing minimal damage to the ovary. That is very important, because the ovarian function, the reserve is important. So we remove the cyst, and whatever deposits are seen, we remove those deposits as well. Okay, and what happens with endometriosis is, because there is bleeding inside the peritoneal cavity, there will be inflammation and fibrosis. Like I said, everything gets stuck to each other. So what happens usually is, both the ovaries, because they get inflamed, they become behind the uterus and get stuck to each other, and they are stuck there, because of which the fallopian tube, which needs to be straight and nice, instead it gets kinked, or even on that there is inflammation, there is fibrosis, there is obstruction, because of which they are not able to have babies. Again, we correct all those anatomical abnormalities as well. We remove the adhesions, release the adhesions, remove all the endometriotic deposits as far as possible. Now patients with deep pelvic endometriotic deposits, what happens is, there can be deep endometriotic deposits within the bowel, the rectum, on the bladder. So all that sometimes needs to be dissected, taken out, and we need to sometimes it happens, so it so happens that in deep endometriosis we end up doing a bowel anastomosis. We have to cut a portion and stitch it back, even on the bladder. So even it can go up to that stage. So those are the surgical corrections that we do, and once that is done, the next step would be treating them for the fertility, for having a baby. Or the next step would be again going back to the medical management. If it was a patient who was on medical management but the pain was not relieved, we did a surgery, then we go back to the medical management so that it remains suppressed. Whatever microscopic things are there, that remains suppressed. So that is how treatment goes on. Now comes the question whether that is cure. No, it's not. Endometriosis unfortunately can't be cured. It can't be 100% cured, and spontaneous resolution of endometriosis usually never happens. We haven't seen anybody having a spontaneous, just like that it comes and goes. No, even that doesn't happen. So it is something that just for the pain relief, just for the symptomatic relief, just to treat the infertility, we end up doing surgery, correct it, and then again go back to the medical management so that it remains like that till the patient reaches menopause. There are a few patients who don't have any symptoms but still have ovarian cysts, endometriotic cysts, blood filled cysts. For such patients, by our guidelines, we don't have to give them any treatment if they don't have any symptoms. we just need to follow them up every 3 months, 6 months. Keep seeing, looking at the size of the cyst. If it remains the same, if it's not increasing in size, maybe some point of time it stopped growing. Lucky for the patient, but that is okay. Some patients, it will progress. We end up doing a surgery at the end of the day when they become symptomatic.
So, you go for laparoscopy surgery?
Of course, endometriosis, the gold standard is always, like I said, diagnosis and management at the same time. Treating the patient at the same time is what we usually do. Laparoscopic procedures are safe for the patient, good for the patient. At the same time, later it's not a big scar that we are creating on the patient as well. And we will be able to clear the disease better with laparoscopy, because laparoscopy is where we go in with a camera which has magnification. We do see all the deposits possible and try and remove whatever is possible.
So, doctor, now you mentioned about the surgery. Any risk factors associated with the surgery, and I want to know about the success rate of surgery.
Surgery success rate, see, it depends on for what reason we did the surgery. If it is for pain relief, there are a lot of patients who get relief from that severe pain that they endure every month. Pain relief is good after surgery. Infertility, when they come to us, they want a baby. After surgery, we usually give them a few cycles, 1 or 2 cycles for natural conception, but most of the patients end up with either an IUI, IVF, assisted reproductive method to conceive. So it is not about the surgery being not successful. It is about following it up with whatever, for whatever reason we did the surgery. If it was for infertility, we follow up with the reproductive medicine, assisted reproductive techniques, so that they conceive soon before this comes back again, because it, like I said, it doesn't resolve by itself, nor does it get cured 100% with any treatment modality. It will come back. So before it comes back, giving them a baby is important, or before it comes back, the pain relief being started all over again is important. So that is how it goes.
So another query is, usually we say endometriosis causes infertility. Doctor, please explain it in detail for us.
Yeah, why endometriosis causes infertility? The basic thing is because of like I said, pain during menstruation, pain during defecation, pain during urination, I said, but after they get married, during sexual intercourse, they have severe pain. Okay, that is another reason why they would have so much of fear towards intercourse. That is one thing. Second thing, the ovaries are damaged naturally, and like I said, there is inflammation, adhesions, the tube sucking, the fallopian tube sucking, because of which the egg is not traversing into the uterine cavity, nor is the sperm able to fertilize an egg because of adhesions per se. And there are lots of other factors, inflammatory factors within our abdomen, which it is said that they scavenge or destroy the egg that is formed, destroy the sperm that is formed, the zygote that is formed, and a proper implantation doesn't happen in patients with endometriosis. So all those reasons, multiple factors together causes infertility in them. So once we correct the anatomical distortion, whatever has happened in between inside, give them something for a good egg formation, and go in with an assisted reproductive technique, something like IUI or IVF, then they conceive sooner, right after a surgery. That's how we treat infertility, and that is why infertility happens.
So, doctor, if endometriosis once we treat it, is there a chance of it recurring again?
Yes, if we don't suppress, keep the medical management on, it will recur. And some patients ask us, once I have a baby, will this go? See, once you have a baby, when you are pregnant, the 9 months, there is no ovulation, there is no menstruation, because of which all these endometrial deposits will subside, will become less. After delivery, what happens? You are lactating, because of which again you are not ovulating, there is no menstruation. That period of time you will be relieved of the endometriotic symptoms. But after a while they grow back again, because of which you will definitely have those symptoms again. So after one pregnancy, continue with the treatment after the delivery. Once you start getting the symptoms, you will have to continue with the treatment for endometriosis later on as well.
Okay.
There are some patients who conceive right after when they stop lactation itself, they conceive.
Okay.
And the first one would have been after surgery, after IVF, that they conceived, and then later on they conceive spontaneously, and they are taken by surprise usually. But you can understand why it happens, because all the endometriotic deposits are kept at bay till then, and as soon as ovulation happens, and if they conceive spontaneously.
Again, there is a chance
It is not because of endometriosis being cured.
Okay.
It is because it was suppressed all this while, just like us giving the medicine or doing a surgery.
Because there is no ovulation, that's why. So doctor, can you suggest some lifestyle changes to suppress this endometriosis?
It is, lifestyle changes, of course. It is said that this patients complaining of pelvic pain, endometriotic symptoms, when they change their lifestyle in such a way that they are not taking many pro-inflammatory things. See, in our dietary food habits, omega-3 fatty acids, the anti-inflammatory factors, fruits, vegetables, antioxidants, all those help with decreasing the pain. At the same time, when you take red meat, when you take alcohol, those are pro-inflammatory things which will make this pain severe. So it is not proven anywhere by studies that this is what happens, but of course when you follow up a patient who has changed their lifestyle, over a period of time we see that their pain symptoms come down. So it is more of follow up that we see, that on follow up that we see that patients who take supplements, patients who go into a vegetarian diet, they avoid alcohol, avoid red meat, those patients end up having better menstrual cycles, less pain.
So doctor, thank you for giving us a lot of information about endometriosis. Our viewers would like to have some advice from your side for them.
Yes. See, first of all, don't ignore the dysmenorrhea, the pain during periods. When you start missing classes, if you are a small girl, like 16-year-old adolescents, even the girls who go to college, 20s, early 20s, don't disregard dysmenorrhea so much, because if it is increasing, if you have pain when you pass motion as well, when you start getting the pain and the pain is becoming so severe that it is not getting relieved with analgesics, the regular analgesic tablets that you take, consult a doctor so that at least it is diagnosed at an earlier stage. As the severity of endometriosis becomes like from stage 1 goes to stage 4 or stage 5, it becomes more difficult to treat. And once you get married, again, same thing, dyspareunia or pain during intercourse. Of course, there will be some pain, that is not what I am saying, but severe pain, you feel that it is not something that you are very comfortable with, consult a doctor. Again, infertility, don't sit and wait for many years before you consult a doctor and tell them that, okay, we've been trying for the past 3-4 years and not conceiving. Initially, when there is infertility, when you have these symptoms as well, consult a doctor. So, like I said, endometriosis usually takes years to get diagnosed itself, and then comes the treatment. So, the symptoms, the history is all what we need to maybe diagnose you as endometriosis. So, that can help you reaching the physician as early as possible, a gynecologist as early as possible. Dietary modifications, like I already told you, lifestyle modifications, taking antioxidants, taking omega-3, having a better lifestyle, avoiding alcohol, all those things will help with symptomatic relief of endometriosis, the pain that is caused because of endometriosis.
Thank you, doctor. Thank you for being with us and spending a lot of time with us in your busy schedule and giving us a lot of valuable information.
Thank you,
once
Jessica.
again.
That was a nice talk.
So viewers, if you find the symptoms of endometriosis Don't panic. Go for medical intervention on time and take care of your health. Stay happy, stay healthy. This is Jasila Mujib signing off. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.